Good morning. Thank you for having me.
Good to have you on the show this morning. So obviously, heart disease is something that many people have no idea how it starts, how to manage, and even when there's an emergency, they don't know what steps to take. So let us start with, how do you even manage or understand, if you have heart disease?
I think it's important that first of all, we are aware of it. The motivation for us actually starting this campaign was a colleague's father who passed away suddenly. And it turned out that he had a heart attack. Now he was well off and was going about his normal duties, but all of a sudden just died. So the first key thing is really awareness. I think a lot of people do not even know that there is heart disease and that they are at risk of it. And which is why we are here with this campaign, to get people to just be aware that heart disease exists. You are at huge risk for it. And that the one thing that you need to do on today, which is World Heart Day, is to actually get your blood pressure checked, because that is one of the leading risk factors for heart disease.
What are some of the causes, and how do you take yourself to the hospital? What do you start seeing that would likely make you to want to go check your heart out?
So first of all, to, I guess, specifically answer that, is that if you find that you're having irregular heartbeat, it's important to go and get that checked straight away. Because that could be a harbinger of heart disease that can be quite serious. So that's very important. On the other hand, the first step, the challenge with heart disease is that the damage goes on insidiously. That is, you don't realize it's happening. It's kind of silent. When it finally presents, what you might get is chest pain, for example. And so when you get any chest pain, it's very important you go and get that checked out as well. Another symptom, even before we move on, is a shortness of breath. So if you can't breathe properly, that is also a symptom of heart disease.
When somebody has a heart attack, what's the first aid you do? What's the first thing anybody, the bystander, somebody, a family, does before carrying them to the hospital? Because abroad, when they have a heart attack, call 911, they are stabilized when they get there. But here, before you finally see a doctor, it might take you a couple of hours. What can you do in the first response to a heart disease, heart patient?
It's a challenge, and again, this was the motivation for us to start this campaign, to get 100,000 Nigerians to get their blood pressure checked, because a colleague of mine had their father experience this exact same thing. They had chest pain, and within an hour, they were dead. The reality is that because of the way our healthcare system is set up, you really need to prevent this rather than wait, so which is why it's very important, to get your blood pressure checked, to be aware of your heart health before you need it. The one thing that you can do when you are getting out to the hospital is to take aspirin. So 300 milligrams of aspirin that you can chew has been shown to, improve your outcomes if you have a heart attack or have, chest pain. So that's something you could potentially do. But what's very important is getting an ambulance to come to you or going to a hospital very rapidly.
I'm curious because we've had cases where we see men die after sex as a result of heart attack. Now, what do you suggest for someone who probably has this cardiovascular disease? How do they handle the other room business so that they don't end up dying when they're walking?
And to help to buttress what she's saying, sometimes you just feel the heart going big, and you start getting scared.
During the activity. During the activity in the other room. If your heart is doing and you're wondering, hey, am I having a heart attack?
Is that all right?
Or is it normal?
Elijah Angel, what's wrong with you?
Doctor, please go ahead.
So I think, of course, there's a lot of exertion that goes when you're, in the other room.
Okay.
And so if you have, risk factors for heart disease or you have heart disease, it is something to be aware of. And so again, it goes back to the basics of making sure you have your blood pressure checked. If you're on medication, making sure you're taking your medication. And also what's important is a lot of people take some supplements and some extra medications to help their performance. And sometimes, those can actually not really help when you pair it with, some blood pressure tablets you're on or some heart disease tablets. So really, if you have any supplements or extra aids you're using for performance, you really want to check with your doctor to make sure that they are compatible with whatever medications you're taking. I think sometimes when you hear of those stories of people that, pass away in the act of, love making, it is probably because, they've taken it with some other medication that they haven't checked with their doctors.
So
you.
in positioning, quickly, just in addition, in positioning, should the person who has like the heart disease stay like under, not to exert so much energy?
Please. God, don't worry.
Answer.
Please.
Help
The
now.
answer is on the internet. So yeah.
People need help.
Answer. Okay, okay. Doctor, you are laughing.
I mean, I'll have to look at what the research says about positioning. I'm not sure that I can, adequately give the right information prior to looking at the data.
For the
Because really, sexual activity is exertion across the board, right? So I think the important thing is to make sure that you have your, heart checked, your blood pressure checked. If you're taking medications, make sure you're on them and make sure you don't use any supplements without first checking with your doctor.